Okay. Assalamualaikum. Okay, it's me again. I'll be talking about part 3 of types of drug therapy. We continue on with drug tolerance. Since before this we spoke about tachyphylaxis, now we'll speak about tolerance, which is similar to tachyphylaxis, but the duration is longer. Okay, so basically, drug tolerance is the body's ability to adapt to the presence of a drug. The magnitude of the body's response to a particular drug depends on two factors, which is concentration of the drug at its site of action and sensitivity of the target site to the drug. For examples, the drugs are antidepressants medications, which can be benzodiazepines, or analgesia in cancer therapy, where the analgesia in cancer therapy is usually in the form of morphine, and usually morphine has tolerance. And antipsychotics to treat schizophrenia, bipolar, and delusional disorders also has effects of drug tolerance. Okay? So categories of tolerance, it can be divided into innate or natural tolerance or acquired or chronic tolerance. So natural tolerance does not depend on prior use of the drug. It is inborn. Genetically determined resistance to drug in relation to the general population. For example, opioid tolerance, which can be of a genetic variation. That means if you take a small amount, it does not have any effect on you. Or alcohol, those with low innate sensitivity as young adults are at a higher risk for alcoholism later in life, because when they have an innate tolerance to alcohol, sometimes a small amount of alcohol will not induce any effects. They have to take a higher consumption of alcohol to have the same effect. So when they take too much of alcohol, it can lead to alcoholism or addiction when you're adults, right? So that's the risk for people having these genetic variations. And in an acquired or chronic tolerance, it is usually due to a reduced sensitivity to a drug that develops after one or more exposure. And it is usually due to metabolic, functional, or behavioral mechanism of the body. So factors affecting drug tolerance can be many. One of them is pharmacokinetic tolerance, where the persistent exposure makes the drug clearance mechanisms more active, classically by induction of metabolic enzymes. An example is the effect of ethanol or alcohol on cytochrome P450 enzymes. CYP stands for cytochrome P is the term, the number, 450 enzymes. And pharmacodynamic tolerance, persistent exposure to the drug produces an adaptive homeostatic response, whereby the drug receptors are downregulated or the second messenger systems are dampened, such that the pharmacological effect is decreased. And tolerance can be further subdivided under receptor downregulation, where receptors are inactivated or endocytosed and degraded in response to sustained stimulation. Can also be in form of receptor deactivation, where the receptor protein is phosphorylated in response to excess stimulus, for example, the nicotinic receptor and nicotine in smoking. And receptor subunit modification, where a modified receptor complex is selectively expressed with diminished sensitivity for the drug but maintained sensitivity for the endogenous ligand. Such as, for example, benzodiazepines is the drug, endogenous ligand is GABA A receptor. So that means the receptor is sensitive to the endogenous ligand. However, it has reduced sensitivity towards the drug which acts on the GABA A receptor. Okay, so that's the difference. And receptor refractory period is a transient period of tolerance after the last drug receptor interaction. That means once you have a drug receptor interaction occurring, there will be a transient period whereby the drug is attached to the receptor but does not cause an effect. That is called transient period. tolerance. And second messenger changes where the post-receptor second messenger system is deactivated. For example, the drugs are beta-2 agonists. Alright, you will learn this under proprioception. And drug target depletion, where some key molecule is end up in the course of drug actions. Subsequent drug doses will therefore have diminished activity until the key molecule is regenerated. A classical example is presynaptic noradrenaline depletion due to ephedrine or adrenaline therapy, right? And factors affecting drug tolerance, continue on, is physiological tolerance, which is a tolerance to the effects of the drug rather than to the drug itself at a receptor level. Receptor responses may remain the same, but physiological adaptive mechanism restores homeostasis such that the effect of the drug appear to be reduced. A good example of this is the physiological adaptation to the use of vasodilator or antihypertensives, which are used for hypertension, by increasing the heart rate and cardiac output, which maintains the blood pressure. Okay, that is called physiological tolerance. In short, antihypertensive with time, it can have a reduced effect, which is considered as physiological tolerance. And learned tolerance or behavioral tolerance is the development of learned behavioral adjustment that compensate for the drug effect. The result is an apparently diminished drug effect. A good example of this is the alcoholic who might remain safely functional within their own home in spite of scandalous intoxication. A sub-variety of this is conditioned tolerance, whereby the development of behavioral tolerance which is strongly dependent on some specific environmental or behavioral trigger. For instance, conditioned tolerance to the effects of opiates such as morphine, cocaine, or heroin was observed by Ehrman, who found that pre-injection rituals, that means preparation before they started using the injection, which is either by using a spoon or cooking, were associated with a decrease in drug effect. Whereas an injection, suddenly you give either morphine, heroin, works better than when they have the pre-injection rituals, which is related to the drug, such as, I think now it's not done anymore, they use a spoon and they put the cocaine in, heroin most likely, and they smoke it, they burn it, so that there will be gas coming out. So the drug addicts usually do, they take a straw and they sip the smoke coming out. And that is the term that they say, chasing the dragon. Okay, now it's not being used anymore. That technique is not used anymore because there are too many high-tech drugs which can be taken orally and easier to take and causes euphoric state. So that's why there are many drug addicts nowadays rather than before. It's even difficult to treat them now. So there are a few other sub-varieties for acquired tolerance which defeats efforts of classification. One might describe this as tolerance-related phenomena, such as sensitization, which is the development of reverse tolerance, or intolerance if one extends the metaphor. It is actually the increase in drug effect, okay, associated with intermittent doses. Okay, this is seen with amphetamine. So this is the opposite of tolerance, where you can have a sensitization. Okay, cross tolerance is the development of tolerance to multiple drugs belonging to the same class after exposure to only one of them. An example of this is seen in the administration of nitrates, which are used for hypertension and also ischemic heart diseases. Okay, and we'll talk a bit on drug dependence. Drug dependence is the need for the drug to be present in the brain to maintain near normal functioning. Abrupt stopping of the drug leads to withdrawal symptoms. And withdrawal symptoms includes abnormal physical or psychological features that follow the abrupt discontinuation of a drug that has the capability of producing physical dependence. Common withdrawal symptoms include sweating, tremor, vomiting, anxiety, insomnia, and muscle pain. And withdrawal is a biological or pharmacological phenomenon, and it occurs due to the existence of a tolerance to that drug. Withdrawal effects tend to be the opposite to the original effects produced by the drug before tolerance developed. And a compulsive use of a substance, despite its negative or dangerous side effects, is called as drug dependence. So features of drug dependence is actually withdrawal must be observed. Okay, tolerance must be demonstrated, and use of larger amounts of drugs may be needed for longer duration. And repeated attempts to quit or control the use of the drug occurs. Yeah, that means the patient is unable to stop by themselves, and much time spent, yeah, to treat the problems. And physical or psychological problems related to use is very high, and activities have to be given up. Yeah, because when you have drug dependence, you can't work socially or actively because it affects your life. Okay, and dependence is described as progressive pharmacological adaptation to the drug with some necessary features, which is an entity distinct from addiction. It is totally quite at the opposite end of addiction. Yeah, it requires tolerance to develop. It results in withdrawal symptoms. And thus, dependence is a state which is behaviorally distinct from addiction because it does not describe compulsive use. Okay? It's not compulsive. It is a purely pharmacological phenomenon which can apply to substances which have no pleasant CNS effects. For example, beta blockers, which are used for the treatment of hypertension. Okay, unlike addiction, it usually causes the drugs usually causes addiction has pleasant CNS effects. So types of drug dependence, you can have physical dependence. A person may have a physical dependence on a substance without having an addiction. For example, certain blood pressure medication do not cause addiction but can cause physical dependence, because it brings about to lower blood pressure, so better for your health. While psychological dependence, other drugs such as cocaine cause addiction without leading to physical dependence. So tolerance to a drug needing a higher dose to attain the same effect is usually part of addiction. So examples of drug dependence are drugs such as tetrahydrocannabinol, THC, which is the active ingredient found in marijuana or cannabis. Opiates and narcotics, which is found, opiates are, for example, heroin or morphine. Narcotics are in drugs, which are like cocaine, are powerful analgesics that causes drowsiness, sedation, and sometimes feeling of euphoria. And as I've said before, these are the drugs in that group. Central nervous system stimulants include amphetamines, cocaine, dextroamphetamine, methamphetamine, and methylphenidate. These drugs have a stimulating effect, and people can start needing higher amount of these drugs to feel the same effect, whereby it causes tolerance. And central nervous system depressants includes alcohol, barbiturates, and the other drugs. And these substances produce a sedative and anxiety-reducing effect, which can lead to dependence. Hallucinogens include LSD, mescaline, psilocybin, which is what we call as mushrooms, and phenylcyclidine or angel dust or PCP. And this can cause people to see things that aren't there, hallucinations, and can lead to psychological dependence. Okay, so that ends my third part, and I'll continue on with my fourth part and final part following this. Okay, bye. Till then, see you.